My name is Janet Weingartner, and I became a nurse specifically to do hospice work, except it didn't exist when I started. But the needs that people have are exactly the same in 2024 as they were in 1975.
Especially in an age when it feels like trying to optimize everything about living as long as we possibly can, we can miss the importance of paying attention to the process of decline and dying and the dignity and humanity that's inherent in those if you give it that time and attention. What hospice and palliative medicine does in its best form is to show up and say, wherever you are, however you are, whatever has happened to your body, we're gonna meet you there. And we're gonna figure out how to make these days as good as they can be.
So I joined nursing school, and the first hopes was like I would get a normal hospital job and everything. And then the moment I stepped foot in a hospital, I was like, this is not what I want to do. So I spent a semester with By the Bay Health, and I think I just really liked it. And then once I graduated, I already told them like, I want to apply for you guys the moment I graduate. Like this is my dream job, and they took me the moment I passed my NCLEX. The thing I think that really surprised me was how much support a patient can get if they need it. It's pretty amazing that like over the weekend when I'm not working and I come back to work, I can see if a patient was having like a pain crisis, how quickly it can get managed without even me having to be there. And it doesn't matter what time of day it is, it could be 3 a.m. in the morning and they'll get the supplies and medications that they need and the care that they deserve.
What we've noticed is that patients often care less about what the service is called. They care more about the fact that they are staying within a system. Whether a patient is receiving palliative care or home health, we've come to recognize that people like having their needs met by a continuous team of people. So we really organizationally take the notion that the best approach to a patient is a team approach, and we apply it to every part of our organization. So both our hospice and our palliative teams involve a physician, a nurse, or a nurse practitioner, a social worker, and a spiritual support counselor. The hierarchy is collapsed, and each member of the team practices to the peak of their license to provide the best care a patient can have.
So nurse, doctor, therapist, whether that was spiritual or psychological therapist. When I stood in on the first transdisciplinary meeting, all the people were even some younger than my children. And I would look at them and they were just as enthused, just as knowledgeable, just as fired up as we were in 76, in 77. And I went, wow, this is really neat.
There's this really unique vulnerability that you get to experience when people are at some of their lowest points physically and emotionally in their lives. And those conversations, they're really hard, but they're so rewarding. I feel so much happier walking away from work knowing I was able to help people navigate these big, hard emotions and just be somebody to help walk alongside them.
By the Bay Health is a very special place to work because we have deeply competent, dedicated clinicians that collaborate using a team approach. It's an honor to be able to work with folks that are not only deeply committed to their jobs, but are incredibly smart and, using evidence-based care and are empathetic and compassionate and show up with an open heart and tenderness themselves.
But to get the opportunity to be with a patient on their last chapter of their lives and really be like their primary nurse, sticking with them until the end and being with their family and supporting them through it, it really is a huge honor. And you really can feel the difference that you can make on these families and the patients.